Thank you very much, Madam Speaker, and I'm pleased to speak on Bill S5 today, a bill first introduced in the Senate and with us here for consideration. I do have to say, following my friend from Sackville, Preston Chesapeake, where my wife's family lives in Fall River, we're good friends, but I did note with interest in one of his responses, he said their government is an evidence-based government. They make decisions based on evidence. It appears that doesn't apply to the cannabis bill, because certainly their rush to legalize, to keep the Prime Minister's very ill-conceived promise, has been contrary to evidence provided by the Canadian Medical Association, pediatricians, and so forth. So I will start my remarks because my speech will be based entirely on evidence, Mr. Speaker, and I think that needs to be brought here. I'd also like to speak for a moment on how members of Parliament do their job both in their constituency, Mr. Speaker, and here in Ottawa. We don't talk about it enough. We know that Ottawa is full of government relations representatives, lobbyists, consultants, communications people, and we hear from people and groups on bills and legislation. And that's important, Mr. Speaker. We have to be informed. In many cases, we will call them to committee as well to give expert evidence and testimony. But I want to thank a constituent in my riding who brought very thoughtful and informed advocacy to me on S5, and his name is Craig Farrell. He's a store owner in Bowmanville and has been an owner of a store that sells vaping products, and that's one of the elements contained in S5, Mr. Speaker. And Craig met with me and gave a very detailed presentation on how, when it comes to smoking cessation, vaping products have helped up to 1 million Canadians leave smoking, Mr. Speaker. In fact, Craig's own experience guiding and informing people in Bowmanville, he told me in the 5 years his store has been open, he's helped 4,000 people transition from smoking to that e-cigarette or that vaping product. And why that's important, Mr. Speaker, is studies have shown, including a number of them in the United Kingdom, that the vaping and nicotine included in the vaping fumes is 95% less harmful than the tobacco delivery of nicotine, Mr. Speaker. So I think when we talk about this bill, we have to recognize that there are some smoking cessation benefits to some of the products that are going to be regulated under S5. And I want to thank Craig Farrell and store owners like him across the country who met with MPs, whether here in Ottawa or in their ridings, and made their case that they shouldn't be included here. The challenge is they are included in S5, Mr. Speaker. What I would have preferred to see was a bill separately on smoking measures to prevent smoking, because I think we support that. I would have preferred the marijuana and cannabis discussion to be a little more fulsome here in Ottawa. And then vaping, which is totally different, but I do think worthy of regulation and attention, should have been treated differently. But they're not, Mr. Speaker. So I'm going to speak to you today about why myself and my Conservative colleagues support S5. We're disappointed that they've tried to bring a lot of things in. It's an act that amends the Tobacco Act, the Non-Smokers Health Act, and consequential amendments. So it's kind of another example of a Liberal-promoted omnibus bill, Mr. Speaker. But there are good elements in this bill that evidence has shown has led to people stopping smoking. And we know, for decades now, that smoking can have numerous health impacts, including cancer, Mr. Speaker. That's known, and that's why governments since the 1980s have tried to make measures to curb smoking, particularly with young people. And S5, at its centerpiece, is the plain packaging issue when it comes to tobacco sales, promotion, and advertising, Mr. Speaker. Plain packaging measures have shown a marked increase in jurisdictions that have adopted it to prevent people from smoking. And if you look at the jurisdictions that I had a look at, Australia, the United Kingdom, New Zealand, our closest allies. I'm well known, Mr. Speaker, for advocating working even closer with those allies under a program called CANZUC, but those countries have already implemented plain packaging and have had tremendous results. The post-implementation review in Australia of their plain packaging legislation has estimated already within the span of 18 months to 2 years, Mr. Speaker, they estimate almost 110,000 people have stopped smoking as a result of that legislative measure. In the United Kingdom, the government of David Cameron, a Conservative government, Mr. Speaker, brought forward similar legislation and has estimated that that plain packaging move will take 300,000 people in the United Kingdom away from smoking, and the health impacts and the cost to society, the toll on families. And in New Zealand, the government of John Key also brought in similar legislation. So, Mr. Speaker, this part of S5, we're very much in line with what our closest friends and allies can do. And unlike the Liberals that talk about evidence-based decision-making, I'm trying to review the benefit that some of our friends have already had, so we can review their evidence, especially the post-implementation review in Australia, to show that this will have a benefit. And so that, even though there's a lot of things in S5, the centerpiece is the plain packaging piece. I also like to mention, Mr. Speaker, why the Conservatives support S5, despite its omnibus nature, is the fact since the government of Brian Mulroney in 1988, with the Tobacco Products Act they brought in Bill C-51 at the time, there's been a nonpartisan approach to smoking cessation legislation in this House. And I'm glad, despite some of the issues and despite the Liberals voting down our worthwhile amendments at committee, we are still advocating supporting them on this because we see the benefit. Much like governments since 1988 have seen with that legislation. It was a progressive Conservative government of Brian Mulroney. Subsequent changes were made by Liberal governments, and now we're trying to bring that same nonpartisan approach to a public health issue in terms of how can we get more young people to stop smoking or to not get into smoking at all, Mr. Speaker. I'd also like to thank the great advocacy work of physicians, of the Heart and Stroke Foundation, and a number of other great groups that have been at the forefront of some of these smoking cessation pieces of legislation. As I said at the outset of my remarks, we're trying to be nonpartisan here, Madam Speaker, but I am very partisan. I'd like to see the same approach, listening to physicians, listening to healthcare professionals, listening to families in many cases, to stop the rush with respect to some of the measures on the Prime Minister's pledge on marijuana, Madam Speaker. So I guess I can hold out hope that showing all-party support on a bill like this perhaps will have the Liberals revisit their approach to public health policy. Final part of my speech that I'll mention, and it will go back to Craig Farrow and storekeepers and e-cigarette or vaping shop owners that have had concern about S5, is there needs to be regulation in that space as well, Madam Speaker. Before Parliament, I was a lawyer for Procter & Gamble, and I was sometimes a toothbrush lawyer. In fact, some of their electric toothbrushes were medical devices. So they are already regulated. So the vaporizers that heat up the liquid and produce the vape are medical devices, Madam Speaker. It's a Class 2 medical device. And to be eligible for sale in Canada, we're already regulating a part of that industry. You know, they need a device license. They need an establishment license for the facility that creates the vaporizing product. Why, Madam Speaker? Because these items Canadians use on their body or in their body. So we have to have a faith that they're properly regulated, that they're safe, they're fit for use. And that's why there's already regulation. And I'd like to see the same regulation applied to sale, promotion, and labeling of products involved in vaping. Certainly when I met with Craig and a lot of the owners, they already don't list products with candy-sounding names and things like this. But it's important for us to have regulation in place to make sure that's consistent, to make sure that there's not an outlier that allows children to be enticed into this. Because while it's certainly, studies show, better for people and can be an aid in getting people off smoking tobacco, there are health impacts, Madam Speaker, and people deserve to know that. And it's also a $27 billion industry globally, Madam Speaker, now and growing. So it's appropriate for the Government of Canada to regulate. As I said at the outset, I would have preferred separate legislation as opposed to an omnibus-type bill approach here. But nonetheless, the smoking cessation measures within this bill are positive. And I think the vaping industry will also take the positives from this bill, because vaporizing in general, we know, is already going to be used by cannabis manufacturers. They're already getting their device licenses approved for the delivery of a vaporized cannabis once the Prime Minister's cannabis regime is in place, Madam Speaker. But what the vaping stores can look to is, in the future, not just ingredients like nicotine can be part of devices. There's the potential, with proper regulation, for some types of over-the-counter or low-level health benefit products to be part of delivery by vaporizer, Madam Speaker. So if we actually bring regulation certainty to this area of public health, it will actually help Craig and his industry in the future. So, Madam Speaker, it's been my pleasure to speak for a few minutes on this, and once again show that responsible shop owners and industry associations, by bringing their issues forward, I think they're helping make our public debate better. I think they're helping us improve legislation. They're also improving our overall awareness of the risks, but also the positives when it comes to smoking cessation of new products like e-cigarettes and those sorts of things. So that's what Parliament's meant to do: talk about the good, talk about the bad, and in areas where we can get young people off smoking, I think it is important to have all-party support like we've had with S5. Thank you very much, Madam Speaker.